As our loved ones age, we often assume that their decline will be sudden, but the truth is, the body often sends us quiet, subtle warnings long before life reaches its final stage. These signs may seem small at first, something you brush off as part of getting older, but when you look back, you may realize they were there all along. It's only after it's too late that we wish we had paid closer attention. In this video, we're going to reveal 5 key signs that often appear in the year leading up to an elderly person's passing. These are the subtle clues you need to watch out for, signs that could help you better prepare, provide meaningful care, and cherish every moment left with your loved one. By recognizing these early, you can create a safe and loving environment, ensuring that their final days are filled with comfort, dignity, and peace. Stay with us until the end to learn these crucial signs that can make all the difference. If you're ready to understand these subtle warnings and make the most of the time you have left with your loved ones, hit that like button, subscribe, and let's dive in. Your journey to knowing and understanding these signs starts now. One of the earliest and most telling signs that someone may be entering their final year of life is unintentional weight loss. At first, it might seem subtle, a belt that suddenly needs tightening, clothes that fit more loosely, or a once hearty appetite that begins to fade. Many families dismiss it as just part of the aging process, but the reality is, losing weight without trying is rarely a good sign. Weight loss often indicates that the body is no longer absorbing nutrients efficiently. Muscle mass starts to decrease, and essential systems begin to slow down. This rapid loss of strength makes movement more difficult, increases the risk of falls, and leaves the immune system weakened, making the body more susceptible to infections. In the final stages of life, appetite changes can also play a role. Many elderly individuals simply stop feeling hungry the way they used to. The sense of taste dulls, and food no longer provides the same comfort it once did. Meals become less appealing, and they may start skipping them altogether. What starts as a small change in eating habits can quickly spiral into a deeper problem. Underlying conditions like cancer, heart failure, or kidney disease can manifest as weight loss long before more obvious symptoms appear. Even cognitive decline or depression can contribute to a lack of appetite, leading to a downward spiral in the person's overall health. If you notice significant weight loss in a loved one, especially if it's accompanied by a decrease in energy, weakness, or difficulty staying active, it's important to take this seriously. This isn't just about the physical appearance, it's a sign that the body is sending a message, and it's crucial to listen now, so you can prepare with clarity, compassion, and the ability to make every remaining moment meaningful. One of the most noticeable and difficult changes leading up to the final year of life is a deep, persistent fatigue that doesn't improve with rest. This isn't just the usual tiredness after a long day. It's an overwhelming exhaustion that can make even the simplest tasks feel impossible. Getting out of bed may become a challenge. Walking across the room could require an immense amount of effort, and activities that were once routine, like cooking, dressing, or even holding a conversation, start to feel exhausting. This extreme fatigue is the body's way of conserving its remaining energy. As organ function slows down, the body starts prioritizing essential processes. The heart no longer pumps with the same strength, circulation weakens, and muscles don't receive the oxygen they once did. This is why many elderly individuals feel unsteady, weak, and unable to maintain their usual level of activity in their final months. Metabolic slowdown is another key factor here. As the body shifts from producing energy for movement to preserving what it can, this leads to longer periods of rest. The person may require more naps throughout the day and find it increasingly difficult to stay awake for extended periods. Sudden drops in energy levels can also be common, where they may seem fine one moment, but completely drained the next. The emotional impact of this fatigue is equally significant. Many seniors who once took pride in their independence may become frustrated or even embarrassed that they can no longer do what they used to. This can lead to withdrawal from conversations, social interactions, or hobbies, not because they don't care, but simply because they don't have the energy anymore. For families, watching a loved one go from being active and engaged to weak and withdrawn can be heartbreaking. But pushing them to do more won't help. Instead, it's essential to understand their limits, allow for rest when needed, and focus on making their remaining days as comfortable and peaceful as possible. If you notice that your loved one is experiencing extreme fatigue that doesn't improve with rest, it's a sign that their body is going through a major transition. Now is the time to focus on cherishing the quiet moments, offering support, and ensuring they feel loved without any expectations. As a person approaches the final stage of life, one of the most striking changes is in how they think, communicate, and interact with others. You may begin to notice that someone who was once sharp and engaged starts forgetting things more frequently, names, events, or even places they've known their whole life. Conversations may become harder to follow, and they may seem disoriented even in familiar settings. These subtle cognitive changes can occur months, or even a year, before death. This isn't simply everyday forgetfulness. It's the brain, like any other organ, receiving less oxygen and fewer nutrients as circulation weakens. This decrease in cognitive function means that decision-making becomes more difficult, and they may struggle to recognize people they've known for years. In some cases, they may even have brief moments of clarity, only to suddenly slip into confusion again, almost as though their mind is fading in and out. Another common sign is emotional withdrawal. People nearing the end of life often lose interest in social interactions and can become more isolated. They may stop talking as much, avoid eye contact, or spend long periods sitting quietly in silence. It's not that they no longer care about their loved ones. Rather, their brain is no longer processing emotions or social engagement the way it used to. This emotional detachment can also be reflected in changes in mood and behavior. Some individuals may become more irritable, anxious, or easily frustrated. Others might seem unusually calm, detached, or indifferent to things they once cared about. This is not a personality shift. It's the brain adjusting to the body's decline. As cognitive function slows, emotional responses become harder to express, and the person may stop reacting in the way they once did. For family members, this stage can be especially difficult. Watching a loved one withdraw emotionally or lose their connection to reality can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of pushing them to rejoin conversations or reconnect with people, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If you notice a loved one becoming more forgetful, confused, or emotionally distant, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, cherish the quiet moments, and focus on creating an environment that feels familiar, safe, and peaceful. Because even when words fade, love and comfort can still be felt. As the body begins its slow decline, one of the clearest physical signs is a weakened immune system. You may start to notice that your loved one, who rarely got sick before, now seems to catch every cold, every flu, or any small infection that goes around. What used to be minor illnesses now take much longer to recover from, and small wounds, like a cut or bruise, heal at a noticeably slower rate. This is not just a normal part of aging, it's the body's diminished ability to defend and repair itself. As circulation slows and organ function weakens, the body becomes more vulnerable to infections. Pneumonia, urinary tract infections, and skin infections become more frequent, and even oral infections can start to pose a serious risk. Antibiotics that once worked quickly may seem less effective, requiring stronger medications, longer recovery periods, or multiple rounds of treatment to clear up infections that would have once been minor. The healing process itself becomes slower as well. Small cuts or bruises may not heal properly, and chronic wounds can develop, especially in those who are less mobile. Pressure sores can become a serious concern and lead to dangerous infections if not properly managed. The body's inability to heal efficiently means that even minor injuries require much more attention and care. What can be even more concerning is that infections in elderly individuals nearing the end of life don't always present themselves the way we expect. Instead of a high fever or visible symptoms, you might notice a sudden decline in mental alertness or a decrease in energy levels. In fact, a shift in mental clarity is often the first warning sign of an infection, even before other symptoms appear. While it's natural to want to fight against these infections, Families must realize that at a certain point, the focus may need to shift from curing to comforting. Managing the symptoms, keeping your loved one hydrated, and ensuring their skin is clean and moisturized can often do more for their well-being than a series of aggressive treatments. This may be a time when what matters most is not prolonging life, but ensuring comfort and minimizing suffering. If you notice that your loved one is experiencing frequent infections or slow healing, don't simply brush it off as an isolated incident. Recognize it as part of the larger picture, the body's final stages, and begin to prepare for a shift in care that focuses on peace, comfort, and dignity. One of the most telling signs that the body is preparing for its final stages is a noticeable change in breathing patterns and circulation. You may observe that your loved one's breathing becomes slower or more shallow than it used to be. At times, there may be pauses between breaths, or their breathing might become irregular, speeding up and slowing down unexpectedly. Some individuals experience a rhythm known as Cheyne-Stokes respiration, where their breathing alternates between deep, rapid breaths and long pauses. These changes in breathing patterns can start subtly, but over time, they may become more pronounced and frequent. Another common sign of decline is weakened circulation. You may notice that your loved one's hands, feet, or even their nose and ears feel cold to the touch. Their skin may appear pale, bluish, or mottled, especially around their extremities. This is because the body is prioritizing blood flow to vital organs, reducing circulation to areas like the hands and feet. As circulation slows, the heart doesn't pump with the same strength as it once did. Many elderly individuals nearing the end of life may experience shortness of breath even with minimal movement. Simply sitting up, speaking, or changing position could leave them winded or out of breath. You may notice them breathing through their mouth more often, or they may need to stop frequently to catch their breath while talking. If your loved one was once able to walk across the room easily but now struggles to do so, this could indicate that their lung function is declining. Fluid buildup in the lungs can also contribute to difficulty breathing, causing a persistent cough, gurgling sounds, or a feeling of tightness in the chest. Many families mistakenly assume that this is just congestion from a cold, but in elderly individuals nearing the end of life, this often signals that the lungs are weakening. These changes in breathing can be deeply unsettling to witness, and it's natural to want to help. But in many cases, this is simply the body's way of slowing down in preparation for the final transition. It's important not to panic, but rather to focus on comfort. Keeping the room cool, using a humidifier, and offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy may provide relief, but the goal will shift from trying to reverse these changes to making your loved one as comfortable as possible. If you notice changes in breathing, cold extremities, or a bluish tint to the skin, these are clear indicators that the body is conserving energy and circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where your loved one feels safe and at ease. As their body begins to slow, the most important thing you can provide is comfort, dignity, and the knowledge that they are not alone in these final months or weeks. As we come to the end of this video, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing or circulation. These 5 signs are often present in the year leading up to an elderly person's passing. They may not all appear at once, and they may not always be obvious in the beginning, but when you start noticing these signs, it's the body's way of preparing for its final transition. For many families, recognizing these changes can be difficult. It's natural to want to fight against them, to encourage your loved one to eat more, move more, or push through their exhaustion. But sometimes, the best thing we can do is listen to what their body is telling us. Instead of focusing on reversing the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love, dignity, and comfort. This is a time to cherish moments, share stories, and let your loved one know they are valued and not alone. If you're noticing these signs in someone close to you, remember that you are not alone in this journey. Many families have walked this path before, And while it is never easy, knowing what to expect can help you find the strength, patience, and peace needed to navigate these difficult days. Thank you for joining us today. We hope this information helps you better understand the subtle warnings that may arise as we approach the final stages of life. Your thoughts and experiences are important to us. Please feel free to share them in the comments below. Take care of your loved ones and remember, every moment is precious.